Hey viewers, welcome back to my channel. Hope you all are doing well. So in this video I will share a care plan on paranoid schizophrenia. Subject is mental health nursing. So first of all, demographic data. First name Mr. Ramesh, age 37 years, marital status unmarried, religion, occupation, socioeconomic status, address, informant, patient himself and his sister. Then chief complaints: loss of appetite, hearing voices for the past 10 months, difficulty in sleeping. Present psychiatric history: Mr. Ramesh, 37 years aged, was admitted to psychiatric unit OPD on 18/6/2021 with the complaints of loss of appetite, sleeping problem, hearing problem for the past 10 months. Onset onset is subacute. Duration, here it should not be written like suffering from paranoid schizophrenia. It like you should write here that the patient is hearing voices from the past 10 months. Okay, then course continuous, intensity increasing as time goes. Then associated disturbances, say here the associated disturbances are sleeping problem, loss of appetite. History of current episode: patient conveys that he feels unsafe and used to think that people wants to harm him. Sorry, it's not once, it should be once. Want, W-A-N-T. Family history, personal history, prenatal history, natal history, then behavior during childhood. So here the patient had excessive temper tantrums during childhood and no significant history of feeding habit. Then illness during childhood, no evident presence of any illness during childhood. It's like significant illness. Then schooling, adjustment and relation with classmate, average, adjustment and relation with teacher, favorite studies or interest, particular abilities, extracurricular activities, scholastic performance, school popularity. Then cognitive and motor development, learning and reading, intellectual skill and motor skill. Occupational history, then sexual history. Premorbid personality, so attitude to other in social, family and sexual relationships. So patient is unable to believe other. Patient is suspicious and feels uneasy with others. He used to think that people are talking about him and insulting him and wanted to harm him. Then attitude to self, patient's sister says that the patient is not aware about his condition and the client is self-confident. He is not happy with past achievement. Then moral and religious attitude and standard, so patient is extremely religious. Then mood, patient's mood was depressed. He displayed apprehensive behavior and he is too quiet to express his feeling. Leisure activities and hobbies, so patient like to roam around the town in free time. Then fantasy life, then reaction pattern to stress, habits, summary and clinical diagnosis. Physical examination: general appearance, body build, weight, height, nourishment, mental status. Then posture, movement, skin condition, texture, head and face, eyes, ears, nose, mouth and throat, neck, chest. Abdomen, back, extremities, lower extremities, nails, skin, genitourinary, rectum. Now mental status examination. So in case of mental health nursing care plan, you must have to write this mental status examination. So here again you have to write general appearance and behavior. So here, facial expression depressed and emaciated, posture normal, mannerism, eye contact, report, consciousness, behavior, dressing and grooming, physical feature. Then psychomotor activity decreased, speech, he is able to answer the questions promptly. While answering, the client is confident enough and he feels hesitation while speaking. Thought. So here delusion or persecution is present. So whenever you are writing any term like delusion, hallucination, the patient is exhibiting exhibiting delusion or hallucination or illusion, you have to write an example, so that like how why you are writing that patient is exhibiting delusion, you have to mention that. So that's why I have written here that example, that patient says that people wanted to harm him, so it is a example of delusion or persecution. Then and client complained that he heard people talking about him and insulting him. The mood and effect. Then disorder perception. So client exhibited or exhibits auditory hallucination. Example, Mr. Ramesh stated that he is hearing voices for the past 10 months, and his sister conveyed that Mr. Ramesh often complained that people wanted to harm him. She also added that Mr. Ramesh often complained of receiving death threat through telephone number. Then cognitive function. Then orientation, intelligence and general information, judgment, insight, general observation, and finally summary and clinical diagnosis. So Mr. Rom is suffering from auditory hallucination and delusion of persecution, and he is diagnosed with paranoid schizophrenia. Here are the medications: haloperidol, diazepam and olanzapine, doses 10 mg, 10 mg, 10 mg, and IM, IV and oral. And along with that, electroconvulsive therapy, and the patient underwent for 4 cycle of ECT. Now nursing diagnosis: disturbed thought process related to inability to trust as evidenced by delusional thinking and extreme suspiciousness of others. Self-care deficit related to withdrawal, inability to trust as evidenced by inability to perform hygiene activities for oneself. So here it will be inability, not ability, as evidenced by inability to perform hygiene activities for oneself. And then social isolation related to inability to trust as evidenced by expression of feeling of rejection of aloneness imposed by others, and potential for violence self-directed related to common hallucination as evidenced by self-destructive behavior, and disturbed sensory perception related to panic anxiety as evidenced by poor concentration and withdrawn behavior. And here are the care plans, and you will get it from R. Sriveni's book. Nicely it was given in the book. Nursing care plans. Then here you have to write process recording also. Here you don't need to write this identification data as it already given in the demographic data. So you can write it from here only, like date and time of process recording, place of interaction and environment. conclusion. See here you have to write nurse's response, patient's response, and technique, and both verbal and non-verbal responses. Conclusion and summary. And here it is bibliography, so that the nursing care plan portions you can write from this 170 to 178 page. So here the book name is A Guide to Mental Health and Psychiatric Nursing, 4th edition, Sriveni. Guys, if you are getting help from my video, please help me too. Please do subscribe my channel. Thank you.